Hello friends in the Anatomy and Physiology class. This is Hassan Nafid, your Anatomy and Physiology instructor at Madison College in Wisconsin. We're going to talk about the respiratory anatomy tonight. The respiratory system helps to deliver oxygen to the body and expel out carbon dioxide. The respiratory system is one of the first line of defense against microbes, pathogens, and invading organisms through the nose or the mouth. The respiratory system helps to manufacture one of the important steps, substance in the control of blood pressure, that is the angiotensin II. Angiotensin II will help our body to develop renin, which is a potent vasoconstrictor that we need to regulate blood pressure. The respiratory system also clear our body from clots. Clots get to be trapped into the lungs when they are formed. The respiratory system also helps to maintain a regular pH of the body. The respiratory system is the system through which we can smell. Also, the respiratory system helps to maintain and to provide venous return to the heart. This is through pushing of the diaphragm of the internal viscera and increasing the venous return to the heart. I have some models here that I want to share with you, and we're going to go and look at the anatomy of the respiratory system. The respiratory system can be divided anatomically and functionally into two units, the upper respiratory tract and the lower respiratory tract. The demarcation area is the larynx. So the upper respiratory tract starts with the nose, here the opening of the nose, what you call the nares. This is the nasal cavity, and it leads to the conchi. And these are the superior nasal conchi, inferior nasal conchi, and the middle. So superior, middle, inferior nasal conchi. This will lead to the pharynx and the larynx and to the trachea. Taking a look at the upper part here, we're going to find the frontal sinuses. This is the sphenoidal sinuses. Sinuses are air-filled cavities that lighten the weight of the skull. Going back here, this is a hard palate and the soft palate. At the end, you're going to see the uvula. This is a palatine tonsil here. Underneath the tongue, which is here, you're going to find the lingual tonsil. And in the back here, you're going to find the pharyngeal tonsils near the pharynx. The pharynx is divided into three segments, just anatomic like that. This is the nasopharynx, opposite to the nose, so we have the nasopharynx, we have the oropharynx, and we have the laryngopharynx, that is, have some anatomical relationship with the larynx. If you take a look here, this is the area of the larynx. This is the epiglottis, and it's one of the cartilages that helps to protect the trachea during swallowing. So when we swallow, the epiglottis will cover the trachea. I'm going to show it to you this way so you see exactly what's happening. This is the opening of the trachea. This is the esophagus, right? And the larynx is that part of the upper respiratory tract that helps direct the air to the trachea and the food to the esophagus. So upon swallowing, the epiglottis, which is one of the parts, is a flap of elastic cartilaginous tissue. It will cover the opening of the trachea. So no food goes into the trachea and avoiding aspiration and maybe aspiration pneumonia. It is really funny movement that it does. Sometimes this movement is disturbed in some diseases that affect the innervation of the larynx, like strokes or what we call cerebrovascular accidents, or dementia, or any other condition that causes some neurological deficit. Taking a look at another side view of the upper head and the upper airways or the upper respiratory tract, we will identify in this area here, this is the epiglottis. This is the thyroid cartilage, and this is the cricoid cartilage. Here is our vocal cord, vocal fold, and the larynx, which will join the trachea. This is a model of the larynx. The larynx is also known as the voice box. It is a cartilaginous structure. It is formed of 8 rigid cartilaginous parts and a flap of soft elastic cartilage is known as the epiglottis. I'm going to show you the parts of the larynx. The larynx is about 4 centimeters long, and as we said before, the larynx marks the area where the upper respiratory tract ends and the lower respiratory tracts start. Taking a look at the cartilage here, these are the 2 parts, wings of the thyroid cartilage. This is the cricoid cartilage, and underneath it are the rings of the trachea. These are the tracheal rings, cricoid cartilage, thyroid cartilage, and on the top here you're going to find the hyoid bone. Turning it to the side and all the way to the back, we are going to find our 2 arytenoid cartilage. These are 2, they're known as the arytenoid cartilage. These are the corniculate cartilage. This is the epiglottis. And the epiglottis, as we said, it covers the opening of the trachea upon swallowing, and it prevents inhalation pneumonia. It is also important to note that the upper respiratory tract is the part of the respiratory system where gas exchange does not take place. The main function of the upper respiratory tract is to adjust the temperature, the content of the air that is inhaled, and also to direct air to the trachea where it will be sent down to the exchangeable part of the lungs, which are the alveoli. Upper airways can be affected by cold temperature, by cold air, cold drinks, or hot drinks. That sometimes might produce some of the upper respiratory infections or upper respiratory inflammatory conditions like rhinitis, like common cold, or even what you call laryngitis with the hoarseness of voice and some scratching sensation in the throat. Thank you for watching this video, and I'll see you next time in another session of our anatomy and physiology.